He was messing around with the gym with his friends, having a little dunking contest, and a little dunk went wrong and he landed down on his arm. So he sprained the ligament on the inside of his elbow. Not a big deal for most athletes, but for throwing athletes can be a big deal. It's the ulnar collateral ligament of the elbow, the one consistently you see in baseball throwers that have Tommy John surgery. Luckily for Joe, he didn't tear it and just needed some rehab and a throwing program to get him back on the field. Just pretty much a typical reaction for the young boys, because it seems like they're a little bit accident prone, so I see him quite a bit. So it was just another injury that we had to work through. But after seeing him, he's a tough kid, so when he has an injury, it's something real. And so I took a look at his elbow, didn't see anything serious, nothing surgical. It was just something we'd have to work through to get him ready for next season. Well, we never completely immobilized him. We just put him in a sling to limit his activity, and then started his range of motion with a brace, but he was able to, the purpose of the rehab was to get his motion back. Luckily, like most of these important injuries, you're going to know right away. It's going to be a sudden hit, it's going to be a sudden twist with extreme pain. That's a no-brainer. The concern is the stuff that that the athlete complains about over and over again, a repetitive use injury. It's really important for a parent, and they're our best sources of information because they know their child. Some children have a higher pain threshold than others, and so if you have someone who has a high pain threshold that comes in complaining of pain, you got to take it a little bit more seriously. If you have someone who's a lower, sometimes you can let that go a little bit. As an athlete, when you play sports, you're bound to have an injury. Very few athletes go through their career without getting an injury. It's really getting them diagnosed and how you deal with the treatment plan that puts you ahead. So if you're really focused and just know you're going to get through this to get to the next phase, that's what we need you to do. It's the people that are focused in the moment about never getting back that we worry about.